And it's human nature. You know, we see something and maybe even we're afraid we have cancer or we have a disease, and so we try and ignore it and tune it out. And I think that's human nature. But it's so important to overcome that and get in, see your doctor, because early diagnosis does make a difference. And sometimes people will go to their internal medicine doctor or their family doctor with symptoms, and the doctor sort of says, well, I don't think there's anything wrong. And you, as a person, you know your body better than anyone else. And so many times you've heard stories where people go back to their doctor 2 or 3 times or go to a different doctor before they actually get diagnosed for cancer. And so there's an aspect of just following your own body and your own instincts. Because a doctor also needs that, and also needs you to give him or her a very accurate medical history.
I completely agree with you, Scott. For example, in disease called lymphoma, one of the symptoms is a swelling in the neck where lymph nodes get enlarged. And sometimes we see that these patients get treated with antibiotics repeatedly, and that you lose some time, especially in lymphoma. If you catch up early, many patients are curable, and it is very important that the diagnosis is made as early as possible. So if you have a lump in the neck which is not going away with a course of antibiotic, as Scott said, you should ask the doctor, should it be biopsied? I would like to know what it is, and that's important that you take the lead.
Well, I want to thank you for one thing, Doctor. 2 or 3 times you've said that you agree with me, and that's more than Charlene's agreed with me in the many, many years I've dealt with her. So you're a terrific guest. With lymphomas, a lot of times you've got that swollen lymph node, either in the neck or the head or the groin or under the arms, which you don't see in leukemias. And usually, ultimately, the diagnosis of lymphoma is by biopsy under the microscope of the tissue. And for leukemia, it's usually the blood test. And what about the role of a bone marrow test?
Right. Well, since you said I'm agreeing with you always, let me disagree.
Okay, well, here we go.
Yeah, because you just said that the swelling in the neck is mostly seen in lymphoma. That is correct, but it is also seen in some types of leukemias. For example, ALL, acute lymphatic leukemia, sometimes can come with neck swellings because of lymph node enlargement. So I just want to let you know that just a swelling in the neck doesn't always mean lymphoma. It can be an infection, can be lymphoma, or it could be sometimes a sign of leukemia also. So coming back to the question you asked, Scott, is a bone marrow helpful in the diagnosis of leukemia? Absolutely. In fact, in majority of patients, a bone marrow biopsy, that is putting a needle into the bone and taking a sample of the bone marrow with this tissue inside the bone, is the most important diagnostic test. You may be able to get some idea about lymphoma from blood examination, but most of the time, the confirmation of leukemia, and more important, what's the type of leukemia, what are the chromosomes, what are the DNA looking like, these are all important in not only precisely diagnosing the type of leukemia, but also nowadays with all the new drugs, those are important in identifying which is the best drug to treat that particular patient with leukemia. So yes, bone marrow biopsy is very important.
And that's a terrific segue. So somebody's now got a diagnosis of leukemia. Let's talk a little bit about the traditional treatments for leukemia.
Okay. So leukemia, as you know, is a disease that is there all over the body. It is not just in one spot like a lymph node. It is all over because it's a disease of the bone marrow and blood. And we have bone marrow and blood all over the body. So whatever treatment we give should go to all over the body, not in particular. So radiation conventionally is not a treatment in leukemia because radiation only treats that part of the body which is radiated. So the standard treatment or the conventional treatment of leukemia is what we call as chemotherapy. Chemotherapy is a bunch of drugs or chemicals that is given usually through a vein. Usually we put a catheter in the chest to give it, and that is administered systemically. That means goes all over the body, and there are various schedules to do that. But that is the cornerstone of standard treatment for acute leukemia or even chronic leukemia.
And Sharon Manson from a couple shows ago had the catheters on and demonstrated how chemo is infused. But let's talk a little bit about, some of the new developments, Gleevec and some of the other things that really have made such a huge difference for so many patients with leukemia.
Okay. It's a good question. So chemotherapy, as I said, is the cornerstone, but one of the main problems with chemotherapy is those chemicals, they kill the cancer cells, leukemia cells, but they also kill a good number of normal cells in the body, which we don't want it to do. But unfortunately, chemotherapy cannot select the cancer cells alone. So because it kills the normal cells, it causes side effect, and that is why a typical chemotherapy for leukemia causes a major side effect like dropping normal blood counts, which we don't want to happen, and much of the complications from chemotherapy is because of low blood counts. Another important side effect because of chemotherapy killing normal cells is loss of hair. You have seen patients who receive chemotherapy very often losing their hair, and that's also because of this non-specific activity of chemotherapy in normal cells. So one of the advantage of new drugs like Gleevec, Scott just mentioned the name Gleevec, it's one of the miracle drugs, but the general principle is the modern treatment, there are a lot of options which work by what is called targeted treatment. It means these drugs target the leukemia cells and avoid its effect on normal cells. So if you find a target in the cancer cell, like it may be a chromosome abnormality, like in Gleevec, the Gleevec is a drug that works only on leukemia cells that has a particular chromosome abnormality called Philadelphia chromosome. So that's the target for Gleevec. There are other,
in which, by the way, Gleevec was made possible because of research done right here in the city of Chicago.
Absolutely. Thank you for bringing that up. And other
because
drugs,
Chicago really, we have some of the finest medical institutions and some of the finest doctors right here in Chicago that have done remarkable work across the board, but especially in blood cancers, Doctor.
There's no question about that. You know, Chicago has major universities with doctors who specialize in lymphoma and leukemias, who are, top, physicians in the country. And I tell my patients always, if you go for a second opinion, go to one of the institutions in Chicago. You don't need to fly out of the city. And that is a very good point you brought up, Scott.
So I'm doing good.
You're doing very good. Only
once.
one point I disagree. That is the swelling in the neck. Okay. So coming back to the point you asked, that is, there are other drugs which work by targeting cancer cells too. Maybe it's a protein on the surface of the lymphoma or leukemia cell. If you develop an antibody against that, again, when you give it, unlike chemotherapy, these drugs only work on the leukemia cells. So that's the big advantage with some of the new drugs.
And stem cell transplantation is another option, and Dr. Funk talked about it on a show, but you typically there's stem cell transplants that you give the patient back his or her own stem cells, or you get it from a donor. And for leukemia, if I understand it, it's less likely that you're able to use the patient's own stem cells.
You're absolutely right. So stem cell transplantation or bone marrow transplantation, that is a very important treatment for certain types of leukemias. Of course, it's very important to select out the type of leukemia in which chemotherapy is the best option, and some of them transplant is the best option. In fact, in some patients, day one when I diagnose leukemia, I will tell them, you need a transplant, let's start looking for a donor. And as Scott said, yes, in most leukemias, when we do transplant, we get cells from a donor. Doing a transplant from patient's own bone marrow, which is called autologous transplant, is not very commonly done in acute leukemia or chronic leukemia, because it is very difficult to clean up the patient's own marrow clean enough to use it for transplant.
And we probably should, we talk a lot about research and the importance of research. Could you just tell our viewers a little bit about some of the trials, the clinical trials and the research going on in Rush right now?
See, I have been doing clinical research for a number of years, specifically in lymphoma and leukemia, and I cannot emphasize more the importance of clinical trials in developing all these new drugs. A few decades back, when I came out of the medical school, acute leukemia used to be called a death sentence, whereas now we can cure many leukemias. High rates of cure in many leukemias. There are still a lot of leukemias that needs advancement in terms of cure, but the advances that we made are primarily because of the research that happened in this area. And research has been in, for example, in the laboratory. In the laboratory, we take new drugs and try to see which one works best in leukemia cells. And also it can be in the clinic, on the bedside, where we bring new drugs that are not in the market to the patient through clinical trials. And that's the importance of clinical trials. Clinical trials are the best way for patients to get new drugs before they come to the market.
And we've talked a couple times on the program. It's not experimental medicine. You will at a minimum get the standard of care, and at the maximum get a new therapy that will be very beneficial. So it's something that you should talk to your doctors about whenever you're diagnosed with any type of cancer or other disease for that matter. Very briefly, can you tell us about the prognosis and survival rates for leukemia?
Okay, prognosis is a very vague term, but let me give you an idea. For example, acute lymphatic leukemia in children, that is one of the best leukemias in terms of cure. 80 to 85% of patients with childhood acute lymphatic leukemia we can cure with just chemotherapy alone without transplant or any other procedures. In the adult with ALL, the cure rate is not that high. In fact, cure rate varies from 30 to 50% depending on what kind of treatments you achieve. That is ALL. In AML, again, in the AML in the adults, the treatment options we have now have improved the numbers, but overall the cure rate is about 50%. That may vary, it could be higher or lower depending on the patient's leukemia status, patient's health, and ability to tolerate treatment. Things like that are very important. So it's difficult to give a number, but it all depends on the various factors which I mentioned, not only the patient factors, but also the nature of leukemia.
Well, Dr. Veno, thank you so much for joining us and telling us so much really about leukemia. And I think the message is early diagnosis, best doctors, best treatments. Let's invest in research to keep those survival rates going up. And that even within the survival rates, as the doctor alluded to, there are things based on your general health and other things that you can do to increase your own survival rates, because these are across the board numbers, and they are going up, and they have been going up, and we need them to go up a lot more, and research is the key to doing that. So we will be back here next week on Battling and Beating Cancer. We'll be joined by Dr. Stephanie Gregory, who, as you know, is a wonderful lady.
Absolutely.
She is the director of the section of hematology at Rush University Medical Center. And our thanks to Dr. Veno. Our thanks very quickly to Meckler, Bolger, Tilson, Merrick, and Pearson, the law firm that makes this program possible. Also to the beautiful Dorothy, the beautiful Christy, our executive directors. Mostly to you for joining us here on Battling and Beating Cancer. Good night, everybody.
Thank you.